All righty. I told you that that was going to be amazing. Thank you so much, Dr. Maya Rockymore and Dean Obunu. Uh, we are now going to hear from the man himself, Mr. Freddy, as well as Guillermo. I just want to let everybody know we would not be here today without Freddy and coming together with his vision to apply hacking to racism after being so successful as the head of MIT hacking medicine and doing so many successful COVID challenges. As things arose with Black Lives Matter, he said, why don't we get some geniuses together, apply some technology solutions, really get the community activism players here, and maybe even try to influence some policy. So I am forever grateful to Freddy. He has a full lifetime invitation to the cookout. And I look forward to him explaining what we envision as the MIT Hacking Racism Challenge expectations, as well as showcasing a success story with Guillermo for some previous hackathons that they have done.
Thank you, Angel, for that kind introduction, and thanks to everyone who is attending today. And really, as Angel mentioned, these issues really shook all of us when this was happening and unfolding over the summer, and trying to see if we can bring some of the MIT mentality and community to engage stakeholders both inside and outside of MIT to see if we can really make a difference on some of these issues. So I'm basically going to briefly go over what a hackathon is, and then make a few comments about what we hope will come out of this particular new initiative on MIT hacking racism. And then have Guillermo kind of walk through his journey from one of our hackathons over the last few months, and then do a little bit of a fireside conversation and answer some Q&A from the audience as well, to kind of get a better sense of what's achievable through a hackathon and what can you what you should be looking to do both during the weekend itself but post weekend as well. So for what really sets us apart at MIT and through all of our initiatives, whether they were through MIT Hacking Medicine or through the MIT COVID-19 Challenge, has really been that it's not only a focus on the development of the solutions themselves, though that's certainly one of the main products that we definitely look to strive for, but it's really the methodology that we use to get there. And it really falls in sort of these four categories here in terms of the diversity of people that we bring onto the team itself, into the events at the participant level, at the mentor level, at the judge level, at the partners level. For any of these issues that are highly complex, we readily recognize that you need to have all those stakeholders together, from clinicians, scientists, engineers, user designers, programmers, coders, patients, payers, business, finance. You need all those different perspectives at the table from the very beginning, not just to wait until the co-development of the solution, but even at the very basic level of co-definition of the problem. The second component is the design methodology process, where we really truly focus on the problem. And this is why we decided to put on this listening summit today and tomorrow, is really to start that conversation about what are the issues at hand, what are these problems, how do we dig deeper and better define those solutions? That way, when we build the solutions, they can truly address these issues. The third part is the viability or the feasibility of the idea. And that's really speaking to thinking about not just the solution within the silo of itself, but in the context of where it's going to be implemented. What's the infrastructure? What's the environment around it that it's going to be implemented, and how viable will that solution end up being? And attached to that is also the financial viability as well, and the business viability as well. But for this particular challenge, because we're certainly recognizing that the solutions aren't just necessarily startups and ventures, but we're likely be nonprofits, will also be awareness campaigns or educational initiatives, or even policies to a certain extent. And so thinking even about those types of solutions, what are the right stakeholders to get involved? How do you improve the potential success of implementing and executing on those ideas? And then the fourth part is to start building this community of individuals, whether that's our participants or our mentors or our judges or our partners. It's about creating this communal space for all of you guys to innovate in this space and to, although we would love every solution that comes out of the actual hackathon to actually end up getting implemented and executed, we rarely recognize that that's not always true. And so we hope that at least we're giving some of the tools, some of the framework, and now some of the community to tackle future problems downstream, even if you decide to take up a problem post hackathon weekend. So for us at MIT, hacking isn't about gaining unauthorized access or breaking it into systems as you might traditionally think, but it's really about a creative application of ingenuity. And our hackathons really are very different from other hackathons out there. So really, there's not a need to code. There's a highly interdisciplinary, as I mentioned, in terms of the people we bring into the hackathon space, but really focus again on the problem itself to meet real user needs. And of course, that feasibility and viability component that I mentioned earlier. So what does an MIT hackathon look like? Well, they used to look like this, where we would bring masses of people together. But of course, now they look like this, a bunch of Zoom rooms and Slack channels that are being created to bring people together. Just to give you what the process looks like over the weekend. It's usually a 48-hour period that we go through these intensive sprints of design thinking, so to speak. And it starts off with pitching problem areas and spaces that people are interested in working on over the weekend, forming teams in this mixing stage, and then spending most of the weekends, of course, hacking in terms of defining the problem, breaking it down, developing potential solutions to that problem, and going through that iterative process in connection with mentors, and of course, the final presentations on Sunday. So the first night, after you'll get to hear from some of our keynote speakers about, again, more about the problems and the issues, participants will get an opportunity to pitch their problems and to essentially dig deeper into the issues that they want to tackle for that weekend. And any participant can pitch, and they can pitch multiple problems that they see and that they want to work on. But then during the mixing process is when the team formation happens to coalesce around those problems. And again, I stress the point that to build teams around the problem space as opposed to what the solution might be, or as opposed to who you might know already versus or the people at your institution or school. And then the hacking process, versus, as I mentioned, is on the definition of the problem, co-development of the solution, and then also thinking about what that implementation timeline or plan might look like for after the hackathon. And one of the most common things is essentially, if we gave you all the resources that you needed at the hackathon, what would you do with that directly after the hackathon? Because we want to also make sure that not only are the ideas good, but that you also have the right team and the full team to execute on that idea as well. And then throughout the weekend, we'll bring in a couple hundred mentors that really represent all those same diversities that I talked about before, to provide that feedback and to help each of these teams iterate through the process. And of course, the final presentations are going to be very short and relative to what you might be used to. These are all 3-minute presentations, but that really highlight, again, the problem space, the solution you're developing, and what that implementation timeline looks like after the hackathon. And so really our hackathon process falls into this very more simplistic view here, which is to really identify the problem. And that's where the team formation will start happening, breaking that problem down into its sub-problem. Like to say that, the further you break that down and further you define that to the very basics of it, the better and easier it will be for you to start thinking about what is the most applicable solutions. And again, this iteration process is key as you're getting feedback from potential users or end users, but also from mentors, from partners throughout this process. Albert Einstein once said, if he only had 1 hour to save the world, he'd spend 55 minutes on it, defining the problem, and only 5 minutes finding the solution. And a well-defined problem is really about hitting on these pain points in some quantifiable terms, because once you have this well-defined problem, it's much easier for people to readily grasp and understand what you're trying to accomplish. And it serves as a great communication tool to help get buy-in and support from others. And we like to just tell people on how do we define this problem into these 5 W's: the who, what, when, where, and why. Who's actually getting affected with this problem? Who are the end users of this issue? What is the actual problem? What happens if the problem doesn't get fixed? What happens if it does get fixed? When does a problem occur? When in the user journey or when in the lifetime of the problem does this issue really occur? And then where does this problem occur? Does it happen in the home? Does it happen in the government? Does it happen at our companies and institutions? And of course, the most importantly is, why is it important to fix this problem? And also being mindful that all these problems involve multiple stakeholders that need to be involved, and especially in healthcare, is also equally complex too. Is that you have patients, you have to think about providers, payers, pharma in the industry, but also the patient circle of trust or family caregivers is the way we like to break it down into. But the last thought is, again, be very quantitative in how you're thinking about these problems and really get very specific in terms of an end user and trying to tell that story so that people can relate and can easily grasp onto what the issue is. And of course, in healthcare itself, try not to confuse what the end user and the economic buyer ends up being, because those are often two very separate entities. So just to recap, our process is really, again, identifying the problem, breaking it down, building back up, and making it better. And so with that, I'll turn it over to Guillermo to give a quick version of his story of how he came out of one of the MIT COVID-19 challenges earlier this year.
Thanks, Freddy, and thank you, Angel, and to the rest of the team for having us today and allowing me to participate in the important issues of today. As Freddy was saying, my team and I, we came together during one of these hackathons, specifically the COVID-19 hackathons that took place earlier in April and then later again in June. Basically, these were hackathons designed to generate solutions and ideas to mitigate COVID-19. My team and I, we focused on the testing and diagnostics space, specifically for COVID-19. And we've been working on maximizing disease testing efficiency using AI. A little bit about myself. Again, my name's Guillermo. I'm from El Salvador in Central America. I'm an incoming MBA candidate at MIT. I was supposed to start this fall, but then because of COVID and also WePool, I've chosen to defer until next year. And we've been working on this initiative for the past 4 or 5 months or so. Through the hackathon, I'm really proud that we've been able to build out an all-star team, super diverse cohort, both in terms of area of proficiency, skill sets, and just a broad range of experiences, spanning biomedical engineering, doctors of medicine, experts in clinical development, regulatory affairs, all sorts of things. We've really come together to try and be a mitigating factor in the current pandemic. And the issue that we were trying to solve, as I mentioned, was that of testing shortages. I mean, it's no secret, and it really requires not a lot of justification to explain how testing in general, but specifically in the US, has been extremely lackluster. I think that as of the time when we created this presentation, it was less than 10% of the population that had been tested. At the same time, many experts said that over 50% of the population would be predicted to become infected. And many experts are saying that testing needs to be ramped up to 30 million tests a week, and meanwhile, we're doing less than 5 million a week. So, I mean, this is an obvious disparity that needs to be addressed. And one such solution that we thought of back in April to maximize disease testing with the available test kit supply, which is, the problem of testing is it's very improbable that it's going to be fixed with just testing supply alone. And so we try to figure out ways around that. And one such way is the idea of pool testing. It's been widely implemented in Israel and Germany and many states now in the US are doing it. My home country, El Salvador, they're doing it here. And basically the way that it works is you maximize testing with less test kits used. You take specimens from multiple individuals and then you mix them into groups or pools, and then you test each group with a single test kit. And so if that mixed sample comes back negative, then that confirms that everyone that got sampled was negative. And then if that mixed sample comes back positive, then you do individual testing and further analyze the specimens. So obviously, if you manage to consistently pool negative samples, this is an incredible capacity increase for testing. And it's even more compelling in low resource settings like El Salvador or India or many other places, such as Africa. But the problem that we've been trying to tackle that's specific to pool testing is that of the positivity rate of the disease, right? Because as there are more infections and more infected cases, then the probability of encountering a positive sample within a pool that you want it to be negative is higher. And so those pools fail. And one example that we like to give all the time is Florida. Florida's positivity rate has been going from 10 to 25%. And Quest Diagnostics, a big lab doing over 150,000 tests every day, they were given an emergency use authorization to do pooling in Florida. But then a couple of days later, the director said that they won't be doing it just because COVID is so prevalent and the pools fail. And so the decision, the solution that we landed on was basically a decision support software that artificially reduces that prevalence. So it's specifically designed to address that problem. And the way that we're thinking about doing that is using predictive analytics to try and figure out a pretest probability of a specimen testing negative for COVID. And then we arrange sample pools to be pooled. And then for those that we think that are going to be positive, we weed those out to not be pooled. And we can achieve that with the socio-demographic and healthcare data that's being collected today at lab, schools, hospitals, like vital symptoms, whether that person was tested because they had symptoms or because they were a contact tracing hit or whatever. We can use that information to come up with this intelligent pooling segmentation. And one good thing is that so long as that testing assay supports pooling, so rapid testing, antibody, next generation sequencing, PCR, what have you, it could be served by this technology in optimizing pooling procedures. And that's what we've been thinking about. When I was interviewing for MIT, they took us to the Martin Trust Center for Entrepreneurship, and they have this huge whiteboard that says, there's a quote that said, "In God we trust, everyone else bring data." So what data do we have that this would work? The Precision FDA team gave us some data, some synthetic patient records to try and figure out how the tool performed. And what we found was that through use of this AI, we could increase testing capacity by 300% and save up to 70% of tests being used. Especially more compelling when the disease prevalence is low, but this could enable pooling methodologies no matter the prevalence environment. And often what we're asked about is, well, what happens after COVID? What happens if you find a vaccine tomorrow? And the thing is that pooling isn't new. It's been done for malaria, for HIV since World War II. And so this algorithm can be applied for other infectious disease assays like influenza A, B, or HPV. We have someone in El Salvador that wants to do it for HPV to eradicate cervical cancer. And so, you know, we've been working on this for a few months now, and I would say that the MIT COVID Hackathon was an incredible accelerator in terms of our development. You know, it started as a simple idea back in April. We were very fortunate to have won that first hackathon, but the founders and we chose to stick together to our, see that our proposed solution becomes a reality. We kept on working on it. We participated on the second round of the hackathon, and we were very fortunate to have one again. Since then, we've incorporated, which itself was a ruthless process. We've submitted a provisional patent for our technology. We're trying to establish implementation partnerships with the likes of University of California, the Department of Veterans Affairs. We had a meeting with the FDA a couple of weeks ago. It's been a fantastic journey really so far. We've been selected as a semi-finalist in the X Prize rapid testing competition. We're also one of 15 startups invited to present at Health 2020 virtual. That event is going to take place in October. And then very recently, we've been selected to become part of the Creative Destruction Lab cohort in Atlanta for their recovery work stream. Their motto is essentially to bring science products and turn them into massively scalable health solutions or products that benefit mankind. And so, we're really excited about our progress, and I'm certainly very excited to keep working on it. And if anything, it's been an MBA by itself, just learning all the stuff that I've had. And at most, if there's anything that we can do to help mitigate this pandemic and the next one, then that'd be fantastic. So again, thanks so much for having me on here. If you guys have any questions about the hackathon or about our initiative, you can feel free to reach out at any time. I'd be happy to speak with you. And thanks again, Freddy, for hosting me.
Yeah. Well, thanks, Guillermo, for sharing your story. I think when I start off with probably some of the most common questions, which is kind of, there might be people in the audience who, again, have never been in a hackathon, maybe have just a very basic idea of what a hackathon is now. But can you talk a little bit about what your own expectations when you headed into the hackathon that you ended up being at, and how you approached it and how you framed it, to kind of help participants think about, what should they be expecting to do during the hackathon and accomplish during the hackathon, and then of course post hackathon.
Yeah, I mean, I think the primary requirement is that you want to help in some capacity. As I was telling you the other day, I knew that in the beginning I wanted to help out in terms of COVID-19 in any way, shape, or form that I could, and the hackathon became a wonderful medium to come up with new ideas and innovate with people much smarter than I was, or at least with different perspectives or different backgrounds. And so within the hackathon, you should expect to become exposed to different sets of methodologies, of opinions, different ways to think outside the box to address some sort of solution. I think that within the hackathon, what happens typically is a lot of people converge around a similar goal, right? And then depending on how you want to tackle it, many times teams split off and try to tackle it and try to attack it from different angles. And so, of course, the hackathon is a great way to generate ideas and figure out whether this is really a pain point that is implementable. And then after the hackathon, of course, it's completely up to the team to continue and figure out how to make it a commercially, or not commercially, but deployable solution. That's what I'd say.
That's great. And I always think about hackathons as being in a space where there's a lot of random collisions and it's a bit of an organized chaos process. Can you talk a little bit about how you manage that component, right? Like we do give you some amount of structure and some principles on how to move through the weekend, and of course have different injection points, whether it's coming from the MIT organizing team itself or coming from our mentors, or structured sessions. But talk a little bit about how to manage and how did all those different aspects really add value to the ultimate product or solution developed.
Yeah, I think that's actually probably one of the most valuable things is the MIT hack team and the way that the hackathons are structured help provide some sort of structure to the development of your idea, right? But what happens typically is ideas pivot and unexpected turns can happen, and therefore, 1 second, please. So unexpected pivots happen, and of course it's up to the team to maintain its structure and making sure that they're addressing their visibility. Now, the mentors, I would say, are probably the most valuable portion of the hackathon, just because of the incredible feedback and the amount of experiencers that they have, and they themselves, I would say, help shape the solution at hand, right? You might come at it with some angle where you think it's going to work, and then here you go and you encounter someone with 20 years of clinical development experience, and they say, no, this is not possible because they don't collect the sort of data, or you're going to have to go through X amount of hoops. And so I think that process itself really polishes the initiative, right, and ensures that it comes out in a deployable form.
Can you talk a little bit about, what happens after the hackathon in terms of your journey and how, I'm sure it was a little bit of a roller coaster of up and downs and challenges and hurdles you had to overcome, but especially in the context of how coming out of an MIT hackathon made things better or worse, and then also as well as sort of the MIT community of partners that were involved in that process.
Yeah, I mean, that was really the one of the major factors in ensuring that our initiative progressed is the MIT network supporting it. And we've been able to leverage, of course, all the partners like MassBio and several others, and not just figuring out whether the solution is an implementation opportunity, but also for additional mentorship. I mean, it's been 4 months, and a couple of the mentors that we encountered during the hackathon are still providing meaningful advice. A few others, like Yusuf, for example, and yourself, you've provided invaluable feedback of been onboarded as advisors and have helped shape the future of our solution. In addition to that, I think that MIT is the perfect place to foster these sorts of initiatives, right? I mean, incorporation and submitting a provisional patent were the next steps for us coming out of the MIT once we identified that we wanted to turn this into an actual company and not just a project, not just a science project, because the fact is that when you're looking for healthcare and socio-demographic data to train an algorithm, they're not just going to give you, patient details just because you happen to win an MIT hackathon, right? And so that sort of process, with the help of the Martin Trust Center for MIT, with the help of several mentors who themselves were lawyers and helped me identify like what the next steps typically would be. I mean, you have to realize that never before had I been interested in entrepreneurship or anything like that. And as a matter of fact, during my MIT interview, they asked me why I wasn't, because it's one of the 3 available tracks for the MBA. But it's been fantastic, really, just in terms of how it's helped shape my perspective and be this guiding hand that I can fall back on when there's things that I definitely don't know about, or I mean, one of the reasons why I wanted to get my MBA in the first place was to try and learn more about this process, and I mean, it certainly worked through the hackathon before my MBA even begins.
Well, thank you so much, Guillermo, for sharing your story and helping provide some context for our participants and mentors as well as to, what happens in the MIT hackathon and, what kinds of things can come out of these hackathons as well. And so with that, we'll end this session and we'll give everyone at least a few minutes break, and we'll reconvene at 1:05 p.m. for the next session. Indra, I don't know if you had any additional words you wanted to say.
I just wanted to